Hey there, it's Dr. Jim. Thanks for stopping by. My topic today, teaching employees to be sensitive to aging and pain. Good topic because we're all aging and pain is not fun whatsoever. As we age, we inflame. Inflammation causes pain and discomfort. So first of all, let's all come to the agreement that pain is not necessarily a normal part of the aging process. Despite this, pain is associated with many conditions and illnesses that are age-related, like arthritis, certain cancers, and diabetes. Pain can usually be treated, but it has to be identified first and diagnosed. In Western medicine, we generally turn to pain medications, which can be effective, right, in reducing pain and discomfort, especially for older adults. Pain medications can also enhance a person's quality of life as long as the meds do not impair alertness or consciousness. So here are 7 common myths about aging and pain. Just like I started in the beginning, pain is a normal part of aging. False. Pain is unavoidable as a person grows old. False. Elderly people diagnosed with Alzheimer's disease or a dementia-related disorder have a higher threshold or a tolerance for pain. False. It's difficult to assess pain in elderly residents, especially those who are cognitively impaired. False. Residents use pain as an excuse to get attention from staff. False. Elderly people are likely to become addicted to pain medications. False. Acknowledging pain will lead to painful and intrusive tests or loss of independence. False. False, 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 false. Here's the funny part. Some people believe these myths are true, including some healthcare professionals. There are some older adults who also buy into these myths, and therefore they don't express that they're in pain, resulting in a lack of treatment or diminished quality of life. If you buy into the myth, you don't express yourself just because that's the way it is, and it's not. There are many ways to assess pain in older adults, and within the couple minutes that I have, let me share some with you. The best place to start assessing for pain among older adults is to monitor and observe for any peculiar changes in the person's behavior or in their overall condition. 2 eyes. Observe, monitor, watch. Has an activity of daily living, for instance, such as grooming, eating by oneself, or participating in activities, suddenly changed? Is there a big change, a dramatic difference in what they do on a daily basis? That's indicative of something. You have to figure out what it means. Some things to watch for: changes in an older adult's gait or their mobility, any loss of function, decreased activity levels, bracing or guarding oneself. That usually means I'm trying to protect myself from getting bumped or hurt. Fidgeting behavior, restlessness, facial signs like grimacing or frowning, perhaps grinding of teeth. Refusing food could be indicative of dental pain. Dentures don't fit anymore. I have loose teeth which are causing pain. Suddenly starting to wander, striking out or becoming combative, recurrent agitation, so on and so forth. So observing for and identifying pain is one half of the equation. The other half is to provide effective treatment for pain. Most healthcare professionals will turn to the attending physician or the medical director for a prescription for pain meds that will be given in the lowest possible dose. Here's the mantra: start low, go slow. I learned that back in my geropsychiatric practice days. That's how psychiatrists practice. Lowest possible dose, let's start low, let's go slow before we go anywhere else. Staff will need to watch signs of improvement, as well as any adverse side effects from the medicine, as there usually are some mild, or temporary side effects. The healthcare team can also reach out to a consulting psychiatrist who can prescribe antidepressants for pain, especially the tricyclic antidepressants, serotonin or norepinephrine reuptake inhibitors, which are SNRIs, or the good old-fashioned SSRIs, the selective serotonin reuptake inhibitors. These are now commonly, not so much a few years ago, but they are commonly used instead of pain medications, and they may have better effects and results without the negative side effects. So these are used. Antidepressants are used to treat pain from arthritis, diabetic neuropathy, migraine, lower back pain, pain associated with multiple sclerosis, and pain related to stroke. That's all I have. That's all I have for right now. I really want to talk about this much, much more, but I try to keep these short and sweet. Please, healthcare professionals out there, learn as much as you can about being more sensitive to the needs of elderly people in terms of pain. Recognize signs, get it diagnosed, and properly treat it, and then monitor for success or side effects. My name's Dr. Jim. Take care. Help seniors with their pain.